Hello, my name is Dr. Chris Mendoza with Rocky Mountain Dental Anesthesia. We just want to thank you for trusting us with your care for your upcoming dental procedure. We just like to go through a few things to kind of help make this an easy process for you, answer any questions preemptively, and then if you do have any additional questions, feel free to call, email, or reach out to us if you do have any more questions. So you're getting ready to come in for your procedure under anesthesia. The most important thing is we get a comprehensive medical history from you. You should have received or will be receiving some information to go through your medical history. It also has some more information about the anesthesia procedure, the consent forms, and the financial agreement as well. It's really important that you get all of that paperwork together and fill it out as soon as possible. We want to make sure that it's safe for you to proceed with anesthesia, and we don't want you to have to keep rescheduling or changing the date of your planned procedure and surgery. So if you get us that medical history earlier rather than later, we can review it, make sure there's not any information that we do need. Sometimes you might have some medical issue that means that we might need some more information from your doctor, primary care physician, or another specialist that you see in regards to your health. So to have as much time as we can so we can follow up with you is going to be very helpful. Additionally, kind of coming into the anesthesia procedure, make sure you let us know if you have had any problems with anesthesia in the past, if you've been nauseous after anesthesia, if you've been combative. All these things are going to help tailor our anesthetic to better suit your needs and to also better help the dentist who's going to be doing your dental work. Now, a few things to go over. When you come in, it's very important that you do follow the NPO instructions, nothing to eat 8 hours before the procedure, and only clear liquids, so water, Gatorade, apple juice, black coffee with nothing in it. You can have those things up to 2 hours before the procedure. And this is just for your safety. We don't want you to throw up anything during the procedure, which can cause a lot of serious issues. Once you do come, we verify your NPO that you haven't had anything to eat or drink. We'll listen to your heart and lungs, and then again, go over all your whole medical history to make sure there's no red flags before proceeding. After that, we'll have you sit in the dental chair, and we will hook you up to all these monitors, get some baseline readings from you. So one of the first things we're gonna do though, we're gonna be starting an IV. So we can either get that in the hand or the arm, and starting that IV is gonna give us access to give you some nice medications that's gonna get you nice and relaxed. So immediately after that, we'll give you some relaxing medications and make sure that you're nice and comfortable for the procedure. Now, for different procedures, we need different types of anesthetics. Sometimes, and most often for adults, we just do what we call IV sedation, where we run all of our medications through the IV, and then you'll be breathing in oxygen through a nasal cannula. You'll be breathing on your own the entire time, but you will be asleep. The other form is called a general anesthesia with intubation. And what we would do is we would give you the relaxing medicine, get you off to sleep, and then place a breathing tube. Because for some cases, the dentist needs a secure airway during that procedure. And we'll discuss which option is best for you. Typically, most of the time, we do the IV sedation, so you don't have any irritation from that breathing tube, and you don't have any issues related to that afterwards. We will be giving you some pain medicine through the IV, as well as some anti-nausea medications through the IV, although you will be drowsy after the procedure. A couple things to keep in mind: no driving for 24 hours after the procedure. You cannot drive yourself home. No major life decisions after the procedure for 24 hours, and just try to take it easy for the rest of today and perhaps the next morning, depending on how you're feeling. If you do have any questions, again, please feel free to reach out to us and we'd be happy to answer any of them. Thanks.